Why don't you coalesce and speak in an efficient way to the untold numbers of teenage women of color who are being trapped by pregnancy? Where are you?
Doing that. We are doing that. Yes, we are doing that. At the National Black Women's Health Project, we organize self-help groups of women to talk about the realities of their lives. If you don't get and talk to folks' minds, then you have nothing. Nobody is willing to have the discussion.
That's Byllye Avery, founder of the National Black Women's Health Project, now known as the Black Women's Health Imperative. Described as a visionary, Avery established the first health organization dedicated solely to Black women and girls, focusing on the concept of self-help and bringing Black women together to discuss the systemic and socioeconomic factors that contributed to health issues disproportionately affecting them. But what was the point that turned Avery's vision into reality? And how did Avery's philosophy of addressing the root causes of health issues and emphasis on communication redefine how women went about reclaiming their identity and power? The mid-20th century saw the rise of several social movements, notably the well-established civil rights movement and the growing women's rights movement. The 1960s marked the beginning of the second wave of the feminist movement, and by the 1970s, women across the country had started forming organizations that rallied for equality. However, there were still voices and issues that demanded further attention. Consequently, the women's rights movement spurred the creation of sub-movements, such as the Black Women's Movement and the Women's Health Movement. By 1973, Black women, described as the double jeopardy for being at the intersection of the racial and feminist movements, began organizing separately, starting with the National Black Feminist Organization. Simultaneously, the women's health movement began with women activists fighting for abortion rights, as abortion was illegal in all states except saving the mother's life at the time, and culminated in the Supreme Court's ruling in Roe v. Wade in 1973, officially legalizing abortion. While these existing movements sought to address health issues broadly, Black women, especially those of lower incomes, felt underrepresented and excluded as they continued struggling with health crises ingrained into socioeconomic structures. These are the women that Avery sought to give a voice to. Byllye Avery was born on October 20th, 1937 in Waynesville, Georgia. Avery attended Talladega College, the oldest historically Black college in Alabama, where she majored in psychology and first interacted with the civil rights movement. Later, Avery went on to earn a Master of Arts in Special Education from the University of Florida. Tragedy struck Avery in 1970 when her husband, just 33 at the time, suffered a fatal heart attack, leaving Avery with questions about the healthcare system and opening her eyes to its flaws. This experience spurred Avery's interest in resolving healthcare inequities and reshaping activism for Black women especially, who culturally had a difficult time applying the label feminist to themselves as it was conventionally linked to the white middle-class female experience. In 1974, Avery co-founded the Gainesville Women's Health Center, a clinic providing women access to legal abortions.
So when we opened up this abortion clinic, it was a scary time because I was a Black woman doing this with 3 other white women and questioned sometimes why was I there doing this with these white women. And we opened up the clinic and all of the myths that I had inside of me started to fall away. When I saw such a high percentage of Black women come to that clinic, I was blown away.
4 years later, she co-founded Birthplace, an alternative birth center also located in Gainesville, Florida. These experiences opened Avery's eyes to the disparities in healthcare for Black women compared to white women, exacerbated by accessibility, economic, and other racist systemic social factors. She knew then something had to be done. While planning to organize the National Black Women's Health Project months before its first gathering in 1983, Avery said that Black women had no collective voice, in hopes the project would become a platform to bring awareness to health problems faced by Black women. Then, in 1983, Avery organized the first National Black Women's Health Conference. We found in the past that Black women did not go to women health conferences because they did not feel they were invited, Avery explained as the rationale for the conference. We always took women to mean white women. So when the conference said Black women, we knew who it was for. Several newspapers covered the anticipation leading up to the first conference set at Spelman College in Atlanta, Georgia from June 24th to the 26th. Despite the project being in its budding stages, the mission and purpose of the project were unmistakable. Avery believed that Black women needed this conference because they were the major recipients and transmitters of healthcare information in the Black community, functioning as informal health caretakers for their nuclear and extended families, and, in this role, transmitted generations of healthcare and diet habits. The change would start with them. For the 1983 conference, psychologist Dr. June Jackson Christmas served as one of the keynote speakers and explained the purpose of the project was to address the need not only for the development of culturally and ethnically sensitive programs, but also for involvement of Black women in the process of health education, advocacy, and information dissemination. Leading up to the 1983 conference, the National Black Women's Health Project had already established a clear goal of who they were serving and why they were doing so. Perhaps the most crucial aspect of the National Black Women's Health Project was its approach to addressing the health crises faced by Black women. Avery's philosophy was to bring Black women together to communicate effectively with each other by forming self-help groups where they could empower one another through their collective struggle and begin demanding better healthcare for themselves. The 1983 conference served as a vehicle for Avery's methodology to spread, and in 1987 she helped sponsor a teen pregnancy prevention film called On Becoming a Woman, Mothers and Daughters Talking Together, exemplifying how intimate and personal these self-help groups were. The film was first of its kind, produced by Black women that explores female sexuality from the perspective of Black women, and discussed topics like menstruation, sex, birth control, love, and difficulty for mothers and daughters to have conversations regarding these topics. Avery's column from Byllye's Kitchen Table in the National Black Women's Health Project's quarterly news magazine called Vital Signs reiterates the necessity of these groups, not just nationwide, but globally as well. The National Black Women's Health Project established an international program called Sister Reach. In working with a women's group located in the capital of Cameroon, Yaoundé, Avery realized a universal in womanhood: the lack of information, misinformation, inability to talk about menstruation, fear, shame, amazement, secrecy, and isolation.
In the Black women's health movement meetings, that this was sometimes the only or the first opportunity for Black women to share with other women their experiences of racism, and that this then they saw in the manner of consciousness raising more generally, they saw what they saw as sort of individual problems they saw were shared among other Black women, right? And that too was super powerful.
The 1983 conference also tackled heavy topics and chronic conditions related to low income, such as infant mortality and teenage pregnancy, as well as issues like rape, domestic violence, and poor mental health, through workshops and seminars.
And so when we look at some of the Black self-help groups that emerged in the 1980s, some of these groups united women in community for years, right? And that helped them understand that feelings of shame and stigma that they are feeling should be turned outward to the systems of oppression that are helping to create and silence oppressive situations.
But what was on top was these other issues that we hadn't dealt with, these kind of social issues. And until you can get rid of that, you can't work on the other. The way the discrimination, racism, sexism, homophobic, classism, all of these issues and violence and just the general oppression of women, it robs you of your self-esteem. As long as you got this weight on your shoulder, this oppressive foot, we can't move.
Although incredibly pressing, Avery argued that these issues could only be addressed after Black women rediscovered their power and self-esteem. Avery and the National Black Women's Health Project understood Black women's health issues extended far beyond just health. The health crisis they faced was largely affected by socioeconomic disparities and systemic social structures that put Black women specifically at a significant disadvantage. Whites often come into Black neighborhoods and tell women their biggest problem is the high infant mortality rate, explained Avery. The people of the neighborhood respond that their biggest problems centered around jobs, decent housing, and getting enough food. There's a contrast between public perception and reality. While Avery fought for rights specific to women like reproduction, she also distilled these health issues to inadequate basic human needs. What each were missing was that they were talking about the same thing, she continued. How can you have a healthy baby if you're worrying about where you're going to live, not eating healthy foods, and have no income to seek the proper medical treatments? Avery spoke at several events in the years following the first health conference, keeping with timely topics such as abortion.
Talk to someone next week who you have not spoken to about this issue. Make a commitment to struggle with them. When they ask you the question, what about this? What about that?
What about this? Get the information straight, but be willing to struggle.
After the conference, Avery would go on to receive a MacArthur Fellowship and the Lucretia Mott Award, and throughout the 1990s continued working on improving health for Black women, traveling internationally to countries such as Brazil and South Africa to spread HIV and AIDS awareness, writing a book titled An Altar of Words, Wisdom, Comfort, and Inspiration for African American Women, and attending many more Black women's health conferences for years to come. Initially, Byllye Avery anticipated a couple hundred women to attend the conference. However, ultimately over 1,500 Black women came by the thousands, from California, Washington, Nevada, New York, Texas, and from cities and towns from across the country. The 1983 conference served as a turning point for Avery, transforming her vision of an organization that empowered low-income Black women to take control of their healthcare and advocate for themselves into reality. Avery showed us how change can begin with community, building spaces for Black women to heal and rediscover themselves. Although the organization, now called the Black Women's Health Imperative, has since shifted away from self-help groups towards public policy, it continues to serve Black women and communities across the nation. Avery's activism with the National Black Women's Health Project, prioritizing the needs of the person first and empowering them through community, has pushed us all to think deeply about what truly lies at the center of social inequities, and serves as an inspiration for current and future generations to continue advocating for issues worth fighting for.
We are a force to be reckoned with. So don't sit by and let them tell us things are not changing around our health care. We continue to be the catalyst to make it happen. And remember, nobody's going to do this for you. We are the ones we've been waiting for. So give them hell.